What is the Massfix blood test?
So the mass spectrometry is a way that we can actually break down the proteins and actually detect what is the sequence of amino acids in those proteins. And from the point of view of the serum M spike, we can actually detect the exact mass of that monoclonal protein, which then allows us to identify very, very small amounts of the monoclonal protein in the serum beyond the resolution of the currently available immunofixation techniques. But it also allows us to specifically identify the monoclonal protein for a given patient so that we can distinguish it from a monoclonal protein that may be coming from a monoclonal antibody that is being used for treatment. So it's more sensitive and more specific than the current approaches for detecting monoclonal protein.
One of my colleagues, Dave Murray, brilliant guy, came up with this idea that using mass spectrometry, one could potentially identify a given patient's monoclonal protein by using sort of this very large desktop machine called a MALDI, and it basically separates proteins by charge and mass, and basically we just, there's a little bit of work that you do. You put it in these little tubes and you put it in a well in the machine, and a laser shoots at it and you get these patterns and you can actually identify the monoclonal protein. And the really nice thing is that you can identify a specific mass charge, we call it, of a given patient's monoclonal protein. And so if they have a G kappa and they're getting a therapeutic antibody like daratumumab, we can easily tell the difference in mass charge and discern whether it's the drug versus the patient's protein. So when we follow myeloma patients, the workhorses are the serum protein electrophoresis, and that is sort of a quantitative assay. So somebody says, my M spike is 2 grams, 3 grams, whatever. You get that off of the SPEP. But then when you can't really see it anymore, or if you want to know exactly what type it is it an A kappa, a G lambda, whatever, you do immunofixation. So for us, the Massfix is replacing that immunofixation. So we do it for saying what is the monoclonal protein, and then also is it there or not. And it's very, very good at finding little monoclonal proteins, which is very helpful.
There are some new methods by which people are looking at the determination of these abnormal proteins. One of them, the so-called Massfix. There are more sensitive methods now for measuring proteins, and they come from what we call the field of proteomics. And people can take this to much lower concentrations than what you can traditionally do with the protein electrophoresis, immunofixation, or even the light chain. Most of these tests are still early on, so there are some institutions like Mayo Clinic where this is already being tested. It is not a requirement at this point, but obviously we're moving in that direction. And the reason is it allows you for a deeper level of response. So as we strive to get into MRD and better and sustained complete responses, people will want to have better testing. Plus, there's some other value for this. As we look at patients who are going to get monoclonal antibodies, such as daratumumab, it allows you to differentiate some of those markers from that protein ID or protein fingerprinting, if you may.
And actually at Mayo now we don't even do immunofixation anymore. We're doing just this Massfix because we find that it's more sensitive and more specific than the typical immunofixation tests.
We have adopted that at Mayo clinically, and we are hoping that over the coming years that will be widely available in the clinical setting.
So right now it's only being done at the Mayo Clinic. The binding site has licensed the technology from us, so they're developing an assay. So the binding site makes the free light chain assay that a lot of patients have run regularly. And so it should be available other places. Certainly, institutions can get it up and running on their own without it, but it'll be kind of like a package that'll be easier that comes with software and so on.